8:13 now, Thursday morning, January 21st. That's when we talk Thursday morning to our friend, Dr. B, Dr. Brent Wallis with People's Health. January is National Thyroid Awareness Month. And although thyroid disease affects 27 million Americans, more than half of them are undiagnosed. So Dr. B, Dr. Brent Wallis from People's Health joins us today to explain what the thyroid is and why it can be so hard to diagnose. Morning, doctor. How are you?
Good morning, Tommy. I'm doing great. How about you?
I'm okay. Have you recovered from the Saints loss yet?
I don't know. I think it's going to take me a little longer.
Right there with you. Let's start with the thyroid. What is the thyroid?
Sure. So the thyroid is a gland. It's butterfly-shaped, and it's actually located in the neck. It's just above your collarbone. And what it does is it actually produces hormones, which are chemicals that are messengers within the body that they tell the body what to do. So in particular, thyroid hormone really helps the body's metabolism. It controls how fast you move, how slow you move, and controls a whole bunch of functions related to body temperature, development, and really your level of energy.
Who is at risk? We mentioned 27 million Americans, but who is at risk for thyroid disease?
Sure. So there's a couple of groups in particular that have a higher risk of thyroid disease. We see it a lot more commonly in women, and especially women who are approaching menopause or who are already in menopause. So age is definitely a factor. People over about the age 50 tend to have be the people that have more problems with thyroid. But then in particular, some people that have been exposed to things like tobacco, cigarette smoke, radiation, which could be from previous treatment for certain conditions, can cause some problems with the thyroid. And then an interesting one is overconsumption of soy products. So that can be something simple like soy sauce, but it could also be tofu. And that can actually cause some problems. And then over or under consumption of iodine. And iodine usually is found in seafood, and so that is one thing that we see quite often here in Louisiana. And then the last group that we definitely take a close look at is anyone who's got a family history of thyroid disease or really any type of endocrine disorder, even things like diabetes.
Do I want to buy iodized salt or not?
Yeah, in general, most salt is iodized because if you don't get enough in your regular diet, then you do need iodine to create thyroid hormone. What you don't want to do for a lot of reasons is put extra salt on everything because that can cause a lot of other problems, including increased blood pressure.
Yeah, taste it first, man. I don't understand how people start loading up the salt before they even taste it. So if thyroid disease affects 27 million Americans, if it's so common, why is it so often misdiagnosed?
Yeah, I think what the problem is that thyroid disease really causes very subtle symptoms that evolve over a long period of time. So it's not as easy to diagnose as things that cause an immediate symptom that you recognize and you say, okay, I've got to treat that. With thyroid disease, really some of these complications can occur slowly throughout different areas of the body, so it can be a little bit confusing sometimes to recognize that the thyroid is what the cause is.
And I guess it's important to catch it early.
Yeah, definitely. You want to catch it because there's a lot of complications that can come from either too much thyroid hormone or too little hormone as you go through.
So you can have it two ways, right? You can have hyper or hypothyroidism. I guess we'll start with hyper. What is that, hyperthyroidism?
Yeah, so hyperthyroid, which is exactly what it sounds like. The gland is hyperactive, so it's actually producing too much hormone. So since those hormones really control metabolism in your body, you can kind of guess what the symptoms would be. But usually people will present with anxiety, sometimes nervousness, or even difficulty sleeping. It can speed up your bowel as well, so you can develop some loose stool or diarrhea. And then it can cause depression also. One of the things we see is vision changes. It can actually cause problems with your acuity, but also blurry vision. And some people can actually get a protrusion of the eyes, which is related to a specific type of hyperthyroidism as well. Some of the other things I usually watch for muscle weakness And in particular, it affects the upper arms and the thighs. It's kind of the muscles that are closest to your core. And then, like I mentioned before, because the thyroid, controls tolerance to heat and body temperature, it can actually result in heat intolerance and a lot of sweating, even tremors or rapid heartbeat. And then one thing we see, anytime somebody is rapidly losing weight and they're not actively dieting, then that can be a sign of hyperthyroidism as well. And then sometimes when that gland is hyperactive, it can actually enlarge. So on physical exam, your doctor may feel your neck, because what they're trying to do is they're trying to see if they can actually palpate or press on the thyroid, because in general, you actually can't really feel the thyroid gland. There's a lot of complications that come along with that hyperactive thyroid. In particular, heart disease can be a problem. So that's why it's so important to recognize early.
When it comes to hypothyroidism, that's too little hormone?
Yeah, so it's exactly the opposite. And so too little hormone creates kind of the opposite symptoms that we were just talking about. So instead of loose stool or diarrhea, people may present with constipation. Instead of being excitable and anxious, it can actually cause fatigue. And along with hyperthyroidism, it can cause depression as well. And then with the body temperature regulation, it can cause an increased sensitivity to cold as well. One of the really concerning symptoms with hypothyroidism, though, is that it also can cause elevated cholesterol levels. And so that increase in cholesterol can actually cause problems with your blood vessels and with your heart. So you can get clogged arteries, which can lead to heart attack or even stroke. And so, again, that's why we really want to recognize this as soon as we can. One of the things we see with hypothyroidism as well, and we usually screen for it, is patients who have body-wide pains, patients who have fibromyalgia, which is a pain-type syndrome, people with chronic fatigue syndrome in particular, and then even people with carpal tunnel should be screened for thyroid disease, because that can actually be a symptom of low thyroid hormone production.
Wow. If you got this and it goes untreated, tell you what, let me take a break. We'll pick it up here. If you have hypothyroidism and it's left untreated, I guess it can get worse, and we'll talk about what some of the complications can be. We're talking to Dr. B, Dr. Brent Wallis, our friend, Chief Medical Officer at People's Health, and we're talking about senior health. So if you're a senior, keep listening. If you're the son or daughter of a senior, keep listening, because you may be the one to identify some of these symptoms in your parents. It is 8:21, time for traffic now, WWL. Now, Tommy Tucker, WWL, talking to Dr. B, Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health, as we do every Thursday morning at this time, about senior health, and we're talking about thyroid and thyroid disease. 27 million Americans are affected by it, but more than half are undiagnosed. And we were talking before the break, Doctor, about hypothyroidism. If it is left untreated, hypothyroidism, I'll get it right, the signs and symptoms can get worse and more severe, and what can happen?
Yeah, so a lot of things can happen. I was going to mention, too, one of the other telltale signs that we watch for is actually changes in your hair, which is kind of interesting. Yeah, so what happens is because the thyroid hormones actually affect hair growth, with hypothyroidism or low thyroid, you can actually get the growth of very coarse, brittle hair. And in particular, you can actually have some hair loss in a very interesting place. So it usually happens kind of on the lateral sides or the sides of your eyebrows that are closer to the side of your face. And so when we see that on physical exam, usually we will check you for thyroid problems. The problem with hypothyroidism is that the symptoms come on very slowly over a long period of time, and so people kind of just write them off to either aging or kind of, just normal changes in your body. But if you leave it unchecked, it can actually result in a lot of problems down the line. In particular, like I mentioned, heart disease is one that I worry a lot about because of that increased cholesterol and the clogged arteries. But it can also cause some problems with the valves in your heart. And when you have problems with the valves, that can lead to blood flow backup that can actually cause congestive heart failure. So that's anytime we have a patient who comes in with sudden onset congestive heart failure, we like to check the thyroid to see if maybe that's something that we can treat and correct in order to solve the problem.
How difficult is it to diagnose?
Well, that's the really fortunate thing is, once you have the suspicion of it, it's relatively easy to check for. The first thing your doctor will do is a very thorough physical exam because, like we've been talking about, the symptoms show up all over the body from head to toe. So they really do need to do a very comprehensive physical. And then, like I mentioned, we would check for enlargement of the thyroid gland itself. So that's why we touch your neck just above your collarbones to see if we identify any swelling. But really the best way to diagnose it is a simple blood test. And it's done multiple times per year on millions of patients. It's a simple tube of blood. It comes back usually the next day, and it actually can give us an indication of what's going on with your thyroid.
All right, so treatment options starting with hyperthyroidism?
Yeah, so hyperthyroidism or a hyperactive, high thyroid hormone level can be treated pretty easily, usually with medications or even something called radioactive iodine. And like I mentioned, iodine is vital to creation of thyroid hormone. So if you introduce radioactive iodine into the body, it will be taken up by the thyroid, and the radioactivity actually kills the thyroid cells. And because they're hyperactive, you actually want to do that. So that's usually pretty effective. However, there are times where the thyroid is so active that we really can't eliminate the thyroid hormone through medication methods, and so sometimes we have to perform surgery to remove either part of the gland or the entire gland. And when you do that, it means you're not able to produce any thyroid hormone anymore, so then we have to put patients on medication, and that medication is going to be required for your whole life.
What about hypothyroidism?
So hypothyroidism or low thyroid is sort of the opposite. You're not producing enough, so it's very easy to treat that because basically we just supplement the thyroid hormone. And there's a couple of different, prescription medicines that can be used for that. They're very well tolerated. We usually do have to adjust the levels for you because everybody has a different thyroid hormone requirement. But once we get the level right, usually it's established and you're going to be on that for the rest of your life.
And what about thyroid cancer, Doc?
Yeah, so fortunately, thyroid cancer is very uncommon. We don't see it all that often, but the incidence is going up, and so we do watch for it. In particular, in patients, like I had mentioned, who've had a previous radiation exposure, maybe for treatment of a different type of cancer, and then people also who have a family history. And the other thing to watch for on physical exam, if we feel any goiter, which is that enlargement of the thyroid, or nodules in your thyroid, so little bumps in your neck, then that's something that we may have to actually take a sample of, put a little needle in there, and check the tissue to see if it might be thyroid cancer. The other thing I tell people to kind of watch for is sudden onset hoarseness or changes in your voice. That definitely needs to be addressed by a doctor. It's really important to talk to your doctor about these symptoms because, like I said, they're very vague, but they can be treated and diagnosed.
Thank you, Doctor. I appreciate your time. Have a great weekend. You can go to peopleshealth.com/radio to find out more. Call 866-687-7335. Follow People's Health on Facebook, Twitter, and Instagram. Time for WWL First News with Dave Cohen.